Hey everybody, welcome to the Hip Impingement 101 workshop. I'm going to give it just a couple seconds here just to kind of let people start to come in. It's just 3 o'clock now. So I'm going to do just a couple little housekeeping things first, kind of give you an intro to me, and then we'll get started right into the hip content. So first off, welcome. I'm super excited that you guys are interested in learning a little bit more about hip impingement and what exactly it is. This is something that I have spent a lot of time working on. I work primarily with, I work with a wide variety of patients, everybody from CrossFit athletes to dancers, to gymnasts, figure skaters, and then just people that are trying to stay active in general. So this information that I'm going to put out to you guys today is going to really be for anybody. This is a great starting point if you are a dancer struggling with some hip impingement or hip pain. This is a really good starting point for you guys. We're not going to be getting into the details of dance specific exercises today, but that will be coming later at a later date, so stay tuned. But this is really going to be your starting point. If you're not a dancer, this is perfect for you as well, because we're going to talk a little bit about how do we make this more functional with day-to-day exercises, day-to-day life. If you're somebody that's doing a lot of strength training, so squats, deadlifts, things like that, we're going to get into how you actually can reduce the amount of hip impingement that you are feeling. So we're going to kind of cover all of that today. Again, just a little bit of like housekeeping first. Today's focus, again, is going to be generalized, but if you are a dancer, stay subscribed to my email list. I know if you already registered for this workshop, you are automatically subscribed to my email list. Keep your subscription to that because I will be putting out more information and details regarding a dance specific hip workshop that I'm going to have coming up in the next couple weeks here. I'm also looking for more topics that what you guys want to hear and what you are interested, dancer or not, what you might be interested in as far as upcoming virtual workshops. Who knows how long this is all going to be going for. So really at this point, I'm taking everything virtual for the foreseeable future. So if there is a topic or something that you are interested in hearing, do me a favor, just write it over in that chat bar on the side of the screen. And I will go back and review those at the end of this and make sure that we start to schedule in some other workshop topics that you guys are interested in. The other thing that I would ask, if this is something, if you enjoy the workshop at the end of this and you feel like you got a lot out of it, if I could please request, it would be awesome of you if you guys would hop over to my Google page or Facebook and write me a review. Those reviews really help me reach a broader audience, and they mean the world to me when I'm able to share something positive with you guys. And so if you could just do me the favor of letting me know what you think, give me some feedback, write a review so that I can help more people. Again, you can just Google On Point Wellness and Rehab and then just write a review in there, or you can head over to my Facebook page, which again is On Point Wellness. That would be really awesome of you guys. And then the last thing that I just wanted to mention, if the information that we go through today, again, is going to be kind of generalized here. However, if it is something that you are interested in a little bit more detail, a little bit more one-on-one specific to you and a problem that you individually are having, I do offer one-on-one appointments. They are all virtual right now, of course, just with the way that everything is. I'm hoping in May I'll be able to get back into the clinic and be doing in-person visits. But until that time, everything is virtual and online. And I must say they've been going great. I've been doing a bunch of virtual visits. And realistically, we're able to do everything that we would do in a regular visit, aside from any hands-on either treatment or cueing or things like that. So if it is something that you want a little bit more guidance for, I am offering a discount for anybody that was registered for the course. You get $10 off your initial evaluation. So it's a 60-minute evaluation. So the cost is $140. And that can either be, if you have a current injury or issue, we can do it as a physical therapy visit if you are somebody that needs formal physical therapy, and that would be something we could talk about. Or if you're not really needing physical therapy, but you're just looking for some technique correction, maybe some one-on-one tips as far as exercise programming, what you can do at home, things like that. That's more of a wellness visit. So we can also do something like that. Physical therapy visits right now are being reimbursed for telehealth. Wellness visits are not, and they probably never will be reimbursed. But again, your health is probably the best investment that you can make. So for $140 to get an awesome individualized exercise program, that can be a really great benefit to you guys. So yeah, those are the things I just wanted to kind of get out of the way. If you have any questions on any of that, you can always send me an email. It's jenna@onpointwellness.com, or you can visit my website for more information. So it looks like we're ready to kind of get started here into the workshop content. So do me a favor. I'll be honest, I have not used this live chat feature yet. So just give me a little thumbs up or a wave. Let me know that that chat feature is working. Because if you guys have questions, I want you to stick them in that little box there. I'm not going to answer them during the workshop. I'm just going to kind of keep going, but I will go back and answer them at the end. I'm going to leave some time at the end for any specific questions that you guys have. So just give me a little thumbs up. Okay, good. Looks like it's working. Perfect. Okay. So yeah, as I'm going through all this content, please write your questions there. And like I said, I'll scroll back through at the end. I won't answer it right at that moment, but we'll scroll back through and try to get to as many questions as I can. So the other thing that if you guys can just, again, use that little box for me, give me a like a thumbs up if you guys are a dancer. How many of you guys are dancers? Just so that I know kind of I had people schedule that were dancers and not dancers. So how many are in here that are dancers? That will be helpful for me to kind of know going through some of this. All right, so hip impingement. Okay, so what is it? I want to give you guys a little bit of background first. We're going to talk about what it is, the anatomy behind it, and then we're going to get into some actual exercises that you can do for it. Okay, good. Looks like we got a bunch of dancers in here. Okay, perfect. All right, so what is hip impingement? Basically, we are looking at the hip joint itself is called a ball and socket joint. So what it is you got the femur or the thigh bone, okay? That's this, I'm gonna use my hand here. So this is the femur or the thigh bone, okay? The ball, this is the head of the femur. That creates the ball of the hip joint. Now then we have the socket, which is gonna be, it's called your acetabulum. It's on your pelvis and it kind of clicks in right through here, okay? So we've got a ball and socket joint. It's a pretty secure and pretty deep joint. And so we don't see a lot of hip dislocations or anything. However, there are some structures that can very easily get pinched on or strained or sprained, or there's a lot of different things that are actually going on in that joint. So that's what we're trying to kind of touch on today, are all these extra structures that are in the joint beyond just the bones that can get irritated and inflamed because of hip impingement. So when we're looking at impingement, again, we've got this ball and socket joint here, okay? Ideally, when you move your leg, okay, so again, we're just gonna pretend my arm is my leg. As I move my leg around, the head of the femur should stay pretty well centered in that socket, okay? When it doesn't, that a lot of times is when we actually will start to have some hip impingement. So from a movement perspective, there's kind of two different things that can cause hip impingement. One is movement based and the other is structure, okay? So ideally, all of the muscles are working together and in sync with one another to keep that ball and socket well centered, okay? And that's what we're going to talk a lot about today. From a structural standpoint, the things that we can't change with hip impingement are the bones, right? So when you have hip impingement, you're going to be, if you've ever gone into the doctor and you've had an MRI or an X-ray, they generally are going to diagnose you based on what they're seeing as far as bony landmarks, okay? So there's a couple different things that can happen from a structural standpoint. One is, here's my ball and socket, I can get a bony overgrowth on the head of the femur, okay? And that is one type of impingement, okay? And it's called cam impingement, if you want to know the details. Cam impingement, if there's bony overgrowth on the actual femur itself. We can also get bony overgrowth on that acetabulum, so the socket. That's called pincer impingement. Doesn't really matter which one you have, to be completely honest. We're going to treat them the same. But if you ever have had an x-ray and or an MRI and they've said that in there, that's what that means. So we can have cam impingement, pincer impingement, or we can have a combination of both. So there's a little bit of extra growth on the femur. There's a little bit extra growth on the acetabulum. And when you go to move, either way, whichever type you have, those bones just impinge on one another and they hit a little bit more than we want them to. So we get those impingement symptoms, okay? When the bones hit, not only are we getting what you're gonna feel, obviously you're getting the approximation of the two bones, but what you're actually feeling is the soft tissues between those bones that are being pinched down on. So that's what we're trying to eliminate, okay? When you get repetitive pinching over and over again, we generally start to see some type of inflammation, irritation, and that's where your pain will come into play. So a lot of people with impingement don't necessarily have acute pain that they're suffering from. They just have a lot of discomfort. So, or maybe not even discomfort, but they just feel that pinching and it's irritating. The things that it will happen with, there's kind of a couple different movements that will reproduce those symptoms. One of them is a really common one is anytime you sit for prolonged periods of time. And we're going to talk about why that is. But so if you're somebody that gets a lot of discomfort kind of in the front of that hip joint with prolonged sitting, whether it's in a chair, in the car, or I think we've all been kind of sitting on the couch a little bit more than normal right now. So that can be one symptom. Another time people will feel it is when they're going up and down the stairs. Or some people will get it when they're walking or running. If you're a dancer, I see I got a lot of my dancers in here. The most common time people tell me that they feel impingement is during a développé or a battement movement, possibly like with a turn where that leg, anytime that leg is elevated up to like a 90-degree position. The impingement position itself is hip flexion, adduction, and internal rotation. So let me show you what that is. So hip flexion would be anytime the knee comes closer to the chest, okay? So this is hip flexion. And that happens with a lot of different movements. Again, going up and down the stairs every time we take a step forward. Going into a squat, that's another symptom I didn't mention, but a lot of times going down into a squat. Anytime the knee is coming closer to the chest, okay? Adduction, which I mentioned, is anytime the leg crosses over midline inward, okay? That will also cause some pinching. And then the last motion is some internal rotation. So if that's internal rotation here, but that can happen like if my foot is planted and I pivot or twist my hips, I can get some rotation. So the main movements that will reproduce it, again, just to recap, are flexion, adduction or crossing over, and then that internal rotation movement. So really, anytime you were doing any one of those symptoms or one of those movements, that's generally when people will start to feel hip impingement. So that can happen with a lot of different day-to-day activities. One that we're really going to focus a lot of time on today is talking about going into a squat. So for a lot of people, when they get into that deep squat, especially if you are lifting weights and you're adding a barbell or some free weights or something onto that, and you're going into that deep squat, at the bottom of the squat, that's generally when people will feel that pinching sensation. So that is what we're going to try to work on eliminating today. So that's kind of the idea behind what causes hip impingement from a structural standpoint. We can't change structure. There really is nothing we can do about bone. Surgery is sometimes an option, but more times than not, these are not, if you're somebody that's suffering with this, we don't want to go to surgery right off the bat. That's not necessarily the best course of action. It can be a long recovery. Sometimes it's the only option after you've gone through conservative care, but we really are going to talk here about how do we avoid ever even needing to go down that road. So we can't change structure, but we can absolutely change how your muscles are activating and being able, as I mentioned a little while back, being able to keep that joint well centered. If we keep the joint well centered, you're going to significantly reduce the amount of pinching on those soft tissues and resultant pain. So how do we actually keep that joint centered? Well, basically we need to make sure that you're using proper muscle balance and activation during specific movements. And we want to make sure that their muscles are contracting at the correct time and in the correct sequence, right? So what does this mean? We're going to kind of talk about a couple different key muscles in hip impingement and how you can address those. So the first being the hip flexors, okay? So we're going to talk kind of the front of the hip, I guess, in general. Hip flexors, we're going to talk about a muscle called the TFL, or the tensor fascia lata. We're also going to talk a bit about glutes. Those are on the back side of the hip. So we're going to kind of hit all sides of the hip. So when you have hip impingement, if you're somebody that has struggled with this, then you probably know, I mean, all the pain is generally centered kind of right around the front. And a lot of people, we call it the C sign. When they come in and I say, where does it hurt? They kind of grab right here. So if this looks familiar to you, you probably have some hip impingement. So we call it a C sign just based on because your fingers are in a C. That's generally where the pain is. So the front of the hip, and a lot of times it will wrap kind of out to this outer portion here. And the reason being is what muscles you're actually using. That's generally why you'll start to see that pattern of discomfort. So the hip flexor itself, the tendon, is right on the front right here, okay? Whenever you flex your hip, we want to activate the hip flexor. The job of the hip flexor is to pull that knee closer to the chest, okay? So hip flexor tends to be a muscle that actually, where a lot of people feel like it's too tight, it's actually that it's too weak. So what's happening is when you're flexing that hip up, you're using a lot of accessory muscles to actually try to flex that hip instead of the hip flexor, which is what's supposed to be utilized. So we see a lot of people with hip impingement that have a weakness in their hip flexor. So this is the person that will come into the clinic and tell me, I feel so tight in my hip flexor. And I stretched it and I've stretched it and I've tried all the mobility in the world and nothing has changed. It's probably because hip flexor tightness or shortness is not actually the problem. It tends to not be what causes hip impingement. That is where you will feel the pain because that structure will get pinched on. However, it's usually more of a weakness than an actual shortness or tightness in the muscle. So I mentioned that TFL muscle. So the TFL it's short for tensor fascia lata, okay? That is the muscle that's right kind of on the front outside of your hip right here, okay? It's the top portion of your IT band, okay? So the IT band we hear a lot about, gets really tight for a lot of people. The IT band runs all the way down the side of the thigh into the knee, and it's very thick and rope-like. We can't get a lot of stretching on the IT band because of the structure of the actual tissues. But the top of the IT band is muscle. That's that TFL, okay? So that's where you're gonna get a lot of the contraction and stretching in the muscle or top portion of the IT band. What the TFL does, if we go back to looking at, here's our little pretend hip joint. The TFL is like right on the outside portion here, and then the hip flexor is going to be kind of right in the center. When I overactivate my TFL, what happens is it drives this hip forward. So it pushes the femur forward in the socket. And now, remember I said that the goal is to keep everything well centered. Well, guess what? When that TFL is overactive, it presses the femur forward, and I get a lot of anterior stress or pressure in my joint, okay? And it makes it so my joint is no longer well-centered. So if my femur presses forward and then I try to flex my hip up, guess what? I'm going to get impingement on all those anterior structures of the hip. That really is what with all the exercises we go through today, that idea right there is what we're going to try to target the most. So we're going to try to down train the amount that TFL is working, because it's causing that forward translation. We're going to down train the TFL and we're going to up train or try to increase the activation in the hip flexor. Because when my hip flexor is active and it's not calling on that TFL to help it, my hip can flex, but I get that nice clearing in the joint. I don't get the forward pressure and then the pinch. So we want to strengthen hip flexor, decrease the amount of activation in the TFL. And that, for most people, is going to take care of the majority of the pinching symptoms that they feel. Now, something to keep in mind is this is not a quick fix. This takes a lot of training, a lot of practice, a lot of muscle re-education, that's really what we're trying to do with these exercises. Re-educate the muscles to activate in the correct sequence so that you're not getting that pinching pain. So don't be frustrated if you try these for a day or two and nothing happens. You probably are not going to feel a difference in a week, sometimes even 2 weeks. Most of my patients, when they start to feel the turning point, it's actually around the 3 to 4 week mark of consistently doing these exercises every single day. And it's just because it takes muscles that long to actually start to adapt to the changes that we're trying to make. You've been moving a certain way for probably quite some time. We have to undo all of that. And so that takes time. So don't let that frustrate you. Okay, so hopefully that makes sense kind of on some of the background of what exactly we're dealing with when we're looking at hip impingement. Now let's get into the fun stuff of how we actually help it. What do we actually do to get rid of that pinching sensation? So we're going to start with a simple exercise. We're kind of the most foundational exercises of everything. We're going to start laying on your back. Hopefully you're in a space where you can kind of do this along with me. If not, you can go back and watch the replay and kind of get some of these exercises through that and practice them then. But we're going to start again with just kind of the foundational piece of everything. So we're going to start, you'll be laying on your back. And when we go through these exercises, what I want you to think about is we're going to do a lot kind of from the top down. So we're going to be working on the trunk, okay? And the reason that we're doing that is I want you to think of the core as the center of all your movement moving forward, right? So I'm sure you've heard this before. Your core is your powerhouse. It controls, if you don't have a stable core, your limbs and your extremities can't be as effective. They're not as strong. They're not as stable. So really everything has to come back to the core. And the hips are part of that whole core sequence. And that's why it's so important that we really make sure that you know how to engage those core muscles before we ever get into moving the actual hip joint itself. So I'm going to show you something called bracing. You might be familiar with this. We're going to kind of go through this a little bit quicker so we can get into the hip stuff. But if you've ever done like Pilates, yoga, or even just kind of some traditional core strengthening, you probably already know how to do this. But it's really important as a foundational piece. So in our trunk, we want to think of our trunk like a cylinder, okay? So the top part of the cylinder is the rib cage. The bottom part of the cylinder is our pelvis, okay? So we've kind of got this cylinder here, okay? When I go through my movement, I want that cylinder to stay a cylinder shape. I don't want to break it, right? So if I allow my pelvis to shift into a bad position, either forward or backwards, I'm going to break that cylinder. Same thing is if my pelvis stays nice and stable, but I allow my rib cage to flare open or closed, it's going to break that cylinder. So we really want to try to keep the core engaged so that we're staying in that nice cylinder shape throughout the trunk. So when you lay on your back, what you want to do is try to find that neutral position first. So neutral being my rib cage and my pelvis are in alignment with one another. So there's a couple different ways that you can do this. My favorite and easiest way I think to do it is if you make a triangle with your hands. The heel of your hand is going to be on your hip bones, and the tips of your fingers are going to be on your pubic bone, okay? And you're just going to let that pelvis rock back and forth till you find the position where your hands are laying flat. So I can put a glass of water on top of my hands. They're not tipped in one direction or the other. That's kind of how you find what that pelvic neutral position is. Now, the reason this is so important is depending on the angle of my pelvis, I'm going to either put more or less forward pressure through that hip joint. So if you think back to the beginning when we talked about making sure the joint stays well centered, and I don't want that forward pressure, most people, when they have hip impingement, their movement tends to be a lot of tucking, right? So the butt kind of comes under, my pelvis tucks back. And if here's the head of my femur, when I do that motion, what I'm essentially doing is taking the head of that femur and I'm pushing it forward. So every time I push that joint forward, I'm going to be causing more pinching on those anterior structures. That's why it's really important that we don't get into the habit of tucking. Now, for a lot of dancers, they get the correction. If you are a dancer here, we see a lot of dancers who want to arch their back, right? And so you get the correction of don't arch your back. So to avoid the arching, we over tuck. And so that extra little bit of overcorrection actually can contribute to more pinching. So that's just something to keep in mind. But that's also why it's really important that you can find that neutral position. Because if you go through these exercises and you're in that tucked under position while you do them, you're going to be actually contributing to your impingement instead of making it feel better. This also, back in the beginning, I had mentioned for a lot of people, they feel a lot of discomfort when they sit for long periods of time. The reason being, here, I'll show you. If I sit in that slouch position, right, my pelvis is in that tucked under position here, right? So again, if I'm sitting in that tucked under position for a long period of time, whether it's for schoolwork or sitting at your desk for work, forward pressure of my femur, extended period of time, and a lot of that anterior pinching. So that's kind of where all of this comes into play. All right, so laying on your back. We have figured out how to find your pelvic neutral position. And then from here, we're just going to do that bracing, which is engaging the abdominals, the core muscles. And the way that I'm going to do that is I'm going to imagine pulling my belly button towards my spine to tense up those abdominal muscles without flattening my back to the floor. Because again, as soon as I flatten my back, you'll see I get that tuck under, I get the forward pressure. So we are avoiding that position. There should be a little bit of a curve under your back the entire time. Pelvis stays stable. I've got my cylinder through my core, and I'm just tensing that muscle, okay? Now, once I've got that, I can move into the actual exercise. So if you are doing this along with me, I want you to go ahead and do this as a little test. You're just going to take one leg and you're going to march it up towards your chest. So I'm doing, well, again, what's called knee or hip flexion, knee towards my chest. And when you do that, do you get any pinching, popping, clicking, any of those symptoms, pain? If you do, you are most likely getting some level of impingement in the hip, okay? If you don't, perfect, you'll probably be able to cruise right through this exercise. But what we want to try to do is get you to the point where you can flex that hip up while maintaining the of your trunk, your hip, and making sure that you're getting the femur to stay centered in the hip joint as you move, okay? So the way you're going to do this, I just grabbed some common household items here to show you guys these exercises. So this is a dog leash. You can use a band, a yoga strap, a dog leash, a towel, anything that you've got laying around the house. The main goal is, though, you don't want it to be over stretchy. So don't use a regular TheraBand. Make sure it's one of the real thick TheraBands. because you want some not resistance, but you want to be able to lift your leg with this. And if there isn't, if there's too much give to it, you won't be able to do the exercise correctly. So what I'm going to do is I'm going to take my strap here. I'm just going to kind of crisscross it around my knee, only so that it doesn't slide. If you have a regular old towel, you can just put it right behind the knee here. But again, just so that it doesn't slide, I'm going to kind of crisscross this way. So I kind of crisscross under my knee, and then I can grab it this way. Okay. So what I'm going to do, we're going to go through how do I flex that hip up while keeping that joint well centered. So I'm using my strap, and I'm basically using my arm to lift my leg down. My leg is completely relaxed. My arm is doing all the work. And that's so that you can find that what it feels like to keep that joint centered. So step 1, I'm going to find neutral spine. Step 2, I'm going to do my brace. Now I'm going to use my arms. Step 3 is use my arms to lift my leg up into that march. And as I lift my leg, my hip flexor in this case is staying nice and relaxed. My TFL is nice and relaxed. And I'm imagining, here's the head of my femur. As the leg comes up, I'm imagining driving the head of the femur down towards the floor, okay? So what I'm essentially doing is keeping that joint centered. I'm not letting that TFL kick in and overpower and drive my hip upward and get the pinch. I'm letting that femur drop into the socket so I get a nice crease through my hip. It should feel nice and relaxed across the front of your hip. And you're just going to try that a couple times. And I should feel no pinching with this. If I feel pinching, or if you feel pinching, you can pretty much bet you're probably kicking in with that TFL. You can also keep your hand there. So when you march up, what you should feel is the hip flexor, which is right in the center. That's going to activate. If you feel this muscle out here gripping or tensing when you go to lift the leg, that's wrong. That's that TFL trying to kick in and help, and that's what we're trying to completely avoid. So that outer TFL should stay relaxed through this entire exercise. And again, you should feel a nice gentle crease through the hip. It's all nice and relaxed. Now we started with the strap because you want to be able to learn how to do that movement without causing or proper. You want to be able to learn how to do that movement properly with the right muscle sequencing. But eventually, you have to learn how to contract the muscles to do it. You don't want to rely on something external to flex your hip up, of course. So once you can do that motion without feeling any pinching, you're going to work away from the band. You're not going to use the band anymore. And you're going to try to do that exact same exercise, driving the femur down towards the floor while I'm marching. And you could do alternating legs. I should be able to keep my pelvis in that neutral position, none of that tucking. And I should be able to march my hip up without feeling reproduction of that popping or clicking. Now, even if you get some pinching, or I'm not even pinching, if you get like a little pop or a click, but it's not painful, that's still something we want to try to avoid. Because if you're getting that little bit of a catch, it's probably still impinging. It just hasn't done it enough times that it's becoming irritated to actually get inflamed. So ideally, we still want to get rid of any popping that is not painful as well. You should still be able to do that without any popping or pinching. So let me know, if you guys tried that along with me, were you able to get it to the point? Just put a little comment in the side there. Were you able to get it to the point where it didn't pinch? Or are you still having a lot of trouble where it's no matter what, you're still getting that pinching feeling? And keep in mind, the first time you do this, you may still pinch only because you haven't learned how to do it without it catching. So that's okay. As long as you can kind of get one or two of them correctly so that you know what's right and what's not. I'm just going to come look and see. when I use my hand to push down. Yeah, so sometimes you need that external cueing with your hand, which is absolutely okay. Felt it every other time. Yeah. Yeah, so it is okay to feel it every now and then, hit or miss. It, like I said, around the 3 or 4 week mark, that's when you'll actually start to notice something clicks and you're like, yes, I've got it. Now I know what's right and wrong. So as long as you can feel what it's supposed to feel like, that's kind of what you want to strive towards feeling every time you do the exercise. You only want to work away from the band once you know you can do it properly without it catching every single time. It's okay if it catches every other time. You just have to kind of know how to use the muscles when you're supposed to use them. Okay, so we went through just standard marching with the band and then without the band. And then from there, that's what we call that type of exercise an open chain exercise. And what an open chain, all that means is that your foot isn't fixed. So your leg is freely moving this way. But most of the time when we are working with an exercise or just functional activity, our feet are planted on the ground. That's what we call closed chain, okay? So just to kind of recap, open chain hip flexion is what we just did. So knee coming up this way. Closed chain hip flexion, my feet are planted on the ground, but I'm still bringing my knee closer to my chest, okay? So I'm flexing at the hip, but the foot is planted. Those are the kind of exercises that we're gonna get into next because they are much more functional. And that's what you're doing on a day-to-day basis is a closed chain activity. So once you can do, and this is exactly what I give my patients. I start them in this exact progression. The laying down on your back marches. My goal is that you can be able to get that without the pinching. Once you can achieve that, then you can move on to this next step, which is closed chain. And we're gonna start this closed chain exercise on your hands and knees here, okay? So I can't unfortunately, I can't hold this myself, but again, I did grab another common household item. So this is actually the handle of my Swiffer. It works perfect for this exercise. You can use a PVC, a dowel, a broom, whatever you've got around the house that's just like this dowel shape. Again, I just took the end of my Swiffer off. I knew that this worked pretty well. So I can't quite show you guys this one, but if you have somebody at home that can help you, this is gonna help you find neutral spine when we get into these next exercises. So when you're on your hands and your knees, it can be really challenging to feel what is neutral because you don't have the floor for feedback anymore. So ideally, neutral would be the back of the head touching the dowel, in between the shoulder blades touching the dowel, and then at your tailbone, so like right about here. And all 3 of those points should be able to touch the dowel. If I am, this back here, if I am in too much of an anterior pelvic tilt, so the pelvis kind of dumps forward, sorry, it's kind of hard to see here. Well, we'll just do it without. So if my pelvis dumps forward, I'm going to get that really big arch in my back. So the middle of my back is going to come away from the dowel. If I tuck under too much, I'm going to get that rounding through my back and the bottom of the dowel would kind of come up off my tailbone. So if you have somebody to hold the dowel there for you, that's kind of your goal. Or do it in front of a mirror so that you can kind of get that feedback to see, okay? So once you can find that neutral position, just like you did laying on your back, you want to find that neutral position first. Can you engage and do that bracing exercise? Can you engage your core without having to shift or move the pelvis, okay? So you just want to try to engage the core without moving the spine. And do that a couple times. Once you've kind of got that down, now we're going to go into the actual hip hinge or the hip flexion, okay? So again, weight bearing hip flexion. I'm going to take my hips and I'm going to bring them back towards my heels as far as I can go while maintaining a neutral spine. So as soon as my back starts rounding, I've gone too far, or I just haven't learned that movement yet. So I want you to find neutral. Only go as far as you can. without that spine having to shift one way or the other, okay? Now, we are still getting hip flexion. So if you are somebody that has impingement every time you flex your hip, you might be feeling some gripping or pinching when you do this exercise. It's all the same concept. We want to make sure that that TFL is staying relaxed and the hip flexor is helping flex that hip a little bit. So as I come back, I want the front of my hip to stay as relaxed as it possibly can. I should not be tense through the front of my hip with this one. I'm just shifting back. If you're not sure, put your hand there. If you feel those muscles really tight, you just have to try to release and relax that hip. Take a deep breath to relax those muscles. And I should be able to get that quad, this is called quadruped hip flexion. I should be able to get as far as I can without feeling any sort of pinching in my hip. Good. So hopefully you can kind of feel that and you can get to a point where there's no catching happening in the hip. So this exercise here is the easiest progression of what we call a hip hinge, which is the beginning of both a deadlift and a squat. And again, that's going to be those movements are all very functional things that you do on a day-to-day basis. So if we think about a squat, how often you squat, every time you get up and down from a chair, the toilet seat, in and out of your car, that's a hip hinge every single time you do that. So if every single time you do that movement, you're causing that forward pressure and you're getting a pinch, it makes sense that after a while, you're going to get some irritation and pain with those movements. So we're trying to decrease the amount of that happening. Same thing like if we're going to go over a deadlift motion. So if every time you hip hinge to pick something up off the floor and you drive that hip forward, you're going to get pinching. So that's really the idea behind these exercises, is to retrain your movement. Anytime you need to flex that hip, I'm not getting that forward pressure anymore. I'm relieving the amount of pinching on that anterior structure, and I'm not going to be causing inflammation and pain. So we've got, just to recap here, we've got step 1, laying on your back, doing an open chain type of hip flexion without pinching. Step 2, we bring it to weight bearing. So we do our quadruped hip flexion. Step 3, we've got to bring it all the way up to standing. Okay. Now, this is where you're going to want to use that dowel. All right. So we're going to take that dowel and we're going to put it behind your head. Okay. And again, this is all the exact same movement. We're just taking it into different positions. Okay. So I've got the dowel, again, same positions as it was when I was kneeling. Back of my head, middle of my back, and then my tailbone, okay? And what I'm gonna do from here is I'm gonna hinge my hips, okay? So this is the motion that we're doing. It's the exact same thing I was doing when I was on my hands and my knees. I'm just gonna adjust my camera screen here just a little bit, okay? So it's the exact same thing we were doing on hands and knees. But when we're standing, here's what I want to happen, okay? So step 1, again, is always making sure we've got a neutral spine. I've got a little bit of an arch of my back, but not too much. I don't want to see any of that tucking under, because as soon as I tuck, I get that forward pressure, I get that popping, right? So maintain neutral. Maintain that cylinder with your core. Don't let that rib cage start to flare open or closed. And what I'm going to do is I'm going to send the weight into my heels, okay? My butt is going to go backwards. I'm going to flex at the hip. All of my weight is sent into my heels, and I'm leaning my shoulders forward here, okay? While I do that motion, I'm maintaining a neutral position with my spine, and I'm using the dowel to help me stay there. So as I'm driving those hips backwards, and again, I've got all my weight back in my heels, I should feel the pull through my hamstring, okay? Your hamstring and your glutes are what's helping this happen and helping hold you upright. And in the front of the hip, the front is relaxed. I'm not gripped through that TFL and through that hip flexor. I'm staying nice and relaxed, as I come forward, I get that, I'm able to have that crease in my hip. It's flexing here, okay? If you put your hand there and you feel a lot of tension, we gotta try to relax that tension out. You may need to backtrack down to the floor again if you can't get this, but ideally the front of the hip is nice and relaxed, so I'm getting this creasing motion through my hips, okay? Now, this is the beginning of your deadlift, okay? So if you've ever done a deadlift, this should look pretty familiar. Get my hair out of the way here. So this is the beginning of my deadlift, right? I showed you just the hinging portion here and then back up. But if I were to keep going, that's my deadlift. Same exact thing, I'm just going further. So when you do go into that full deadlift, that's where I want to start to feel that pulling through my hamstrings. And I'm getting my glutes and my hamstrings to activate, and that's what should be working during the deadlift. So I'm strengthening the backside, okay? If I don't feel the pull in my hamstring, what I want you to do, so you're going to start to go down, hips are sent back, crease through the front, weight is in the heels. If you don't feel the pull in your hamstring, what I want you to do is straighten your knees a little bit more, stick your butt up higher in the air. And then once you feel that pull, that's when you can come back up. Down till I feel the pull, lift back up. Now be very cautious as you come back up to standing. There's going to be a temptation to tuck that butt under. I want you to stop just short of that, okay? So I'm coming down, and then I'm coming up, but I'm stopping at neutral. Now, this is an exercise where eventually you're going to add weight to it. So I want every patient that comes in, I want them to be able to get this hip hinge, but we eventually are going to have to load it. You've got to add weight to this. So there's a couple different ways you can do it. I'm not going to grab my barbell just because I don't have space, but I'll just show you with the dowel. So eventually this would be holding the barbell in front of you and doing your deadlift this way. You can also grab a free weight or a kettlebell, and you can hold it in between your legs here. I could also hold, if I had, get my other one, I could do it this way. But it's really important that you learn to load that deadlift motion. If I know there's a lot of dancers in here, and a lot of my dancers will say, well, why do I need to learn how to deadlift? That's not what I do when I'm dancing. And that's absolutely correct. But I want you to think of it as cross training. You're trying to build up all the necessary muscles to reduce your hip impingement, right? So we have to start somewhere. We got to start building the foundation first. You don't want to dive right into all the dance specific things if you haven't hit on how to just get rid of the hip impingement in the first place. So building up the strength into your deadlift and your hip hinging pattern is what is going to get you there. Everybody should be able to do this hip hinging pattern loaded with external weight without feeling the popping or the clicking. So it's really important for everybody to strengthen up that deadlift. So that's one of my favorite exercises is the deadlift. And I give them to most of my patients. Even if you have back pain, it is something that's going to strengthen up your back. That's a whole nother topic we don't really even have time to get into today, but it is safe to do for somebody that has back pain as long as you're maintaining neutral and doing it properly. And I should also mention too, just because we talked about the back pain there, don't forget, so with that deadlift, don't forget about what's happening at your rib cage. So as you come down into that deadlift or that hip hinging position, right? Remember your cylinder, okay? You do not want that rib cage to flare open. So for one of the biggest corrections that I have to give people is that their rib cage is flaring. So when they go down into their deadlift, their rib cage starts to flare out this way and you get this really big arch through your back. So if you're feeling too much tension in your low back, check and see where your rib cage is at. You may need to just tuck that rib cage down a little bit to get more of a neutral position. And that rib cage should stay kind of tucked down the entire time. You're going to get a better core activation when you do that. Okay, so that's taking the hip hinge in the easier direction, which is the deadlift. Not a lot of people get hip impingement when they do a deadlift. It's much more common to get hip impingement symptoms when you go into a squat. So that's what we're going to talk about next. And again, everyone that has hip impingement should get to the point where they can fully do a squat, full depth, without feeling symptoms of hip impingement. And this is just a basic functional movement that you have to do every single day. So it's really important that you learn how to pattern this movement. So the hip hinge, that beginning portion of the deadlift here, it's also the beginning portion of your squat. So that is going to be exactly the same. We're just going to bend the knees a little bit deeper. So I'm going to stay to the side so you can see me here. So I'm still doing that. Step one of the squat is that little bit of a hip hinge, okay? Now the difference is with my deadlift, I keep my knees straight and I bring my trunk forward. With a squat, I hinge, but then I'm going to allow my knees to bend so my trunk stays more upright, okay? So when you go to do this, step one, I got to put my arms out in front just so that you don't feel like you're going to lose your balance. You want to get that hinging pattern down. So my TFL is relaxed. My weight goes into my heels. My butt comes back. The front of my hip is relaxed. I'm not gripped through that TFL, okay? Send the weight back, but then I'm going to keep bending my knees. So I'm already in a position where that femur is driving back this way. It's not pressing forward. I'm not going to get the impingement if it's not pressing forward, right? So I'm driving that femur backwards. Then I'm going to hit a certain point where I'm like, ooh, I really can't go any further without bending my trunk forward. And that's not what we want. So what you're going to allow yourself to do when you hit that point of like, okay, I can't quite go any further, let those knees ever so slightly shift forward. The weight should shift from being just in your heel to going a little bit more into like the ball of your foot, okay? So just in real time, my weight shifts back, knees bend. I can't go any further, so I'm going to allow the knees to shift forward. I can get my butt down parallel to the ground. That's what will give you that last little bit of range of motion, is allowing those knees to shift forward. Ideally, if you're doing this correctly and you're getting that hinge, you should be able to get a full depth squat without feeling any pinching through the front of the hip. And it's all because we're learning how to reduce the amount of forward pressure, decreasing the activation of the TFL, and increasing the activation in the hip flexor. So we're really just repatterning your movement. And for hip impingement, that's so much of what it comes down to, is just making sure, we can't change the structure. So we have to learn, how do you move in a more effective manner so you're not getting the pressure into the wrong areas. I guarantee you, if you're somebody that's like, my hip flexor just feels tight all the time, and you've tried stretching it and nothing is changing it, I guarantee you, if you try shifting away from just stretching your hip flexors all the time and doing some of this, your pain will probably it'll probably go away a lot quicker than it will with stretching. It does not mean that you don't ever need to stretch and mobilize your hip flexor. It's just that that's usually not what's actually causing the problem. So again, if you're a patient of mine and you come in with hip impingement symptoms, I don't give you hip flexor stretches probably until your pain is gone. So, and that can be a month, 2 months. Sometimes I don't ever give people hip flexor stretches and they don't ever need them. It really depends on the person, but most of the time, you really don't need any stretching or mobilizing for hip flexors. Especially, again, if you're a dancer, you're probably plenty flexible in your hip flexors and do not need to stretch them any more than they already are. You just need to learn how to activate them and reduce that forward pressure that's causing your pinching. So hopefully that makes sense. It's a really simple exercise progression that you can go through. Laying on the back, step 1, hip hinging in hands and knees, that quadruped position, step 2, and then step 3 is bringing it up to standing in that hip hinging pattern that you can then bring into either a squat or a deadlift. At the end of this, I'm going to send you guys a follow-up email with a PDF of those 3 movements so that you have the instructions down. You don't have to watch the whole video again. This will be available for replay, but I want you to have that PDF so that you can just have a quick little reference of what exactly that progression is. Practice it, learn it every single day. The more that you practice it, the quicker that the symptoms will start to go away. But it is a learned movement pattern, and it takes a long time to get there. So don't expect it to go away after a week. Just stick with it. All right. So again, if hopefully this all made sense to you guys. If you have specific concerns about being able to do the exercise correctly, or you're feeling like this was really helpful, but you want a little bit more guided instruction, you can go onto my website or send me a message, and we can figure out about scheduling a one-on-one session. If that is something that you need, we can kind of go from there. So let me go through. I'm going to look at some of the questions that people wrote here and make sure that we can answer some of these. Okay. All right. So it looks like, okay. Somebody did have surgery. Yeah. So the surgery, it's pretty common. I treat a lot of my patients have had surgery. I actually get a lot of the patients that have had surgery and that I don't want to say it's failed, because it doesn't mean that it hasn't worked. It's just that they didn't rehab it properly. And so they're still having a lot of pain. Something to keep in mind if you have had the surgery, or if you're thinking about having surgery, the surgery itself does not take away the problem. It takes away the extra little bit of bony growth there. So from a structural standpoint, you should be able to move without anything impinging. However, it in no way changes your actual muscle activation. So if you are still pressing forward and then trying to move the hip, you're still going to get impingement, whether there's extra bone there or not. And that's why it's so important that you find somebody that understands how to rehab hip impingement properly, because that movement piece, surgery or not, the movement piece is what's actually going to take the pain away. Okay, let's see. Is it okay to feel your lower back muscles working? Yes, absolutely okay. Your lower back muscles, so your core itself, the muscles that we're getting at with your core, they wrap around and they have attachments into your back. So when you're engaging and bracing with the core, you're activating some of that low back musculature. So that's completely normal to feel. Just make sure that you're feeling like a good sort of muscle working, and you're not feeling pain there. But just to feel it working, that's normal. You may even find that your back is a little bit sore, especially when you start getting into the deadlifting motion. If you're adding weight to it, your low back is probably going to get sore, and that's okay. That's a completely normal thing. Nothing to worry about as long as it's not painful. Still feel it even with the strap. So if you're feeling it even with the strap, you're probably still not utilizing the correct muscle. You're probably still getting that TFL to kick in and press forward. So what you're going to want to do is if you're feeling it with the strap, you're not going to want to progress into these other exercises until you can do it laying down first. Try to use the strap in one hand and then use the other hand, place it on your hip to help give you some cueing, to make sure that that TFL is not really tensed and spasmed. If you're feeling a lot of tension in that muscle, you're going to feel the symptoms of hip impingement. So you want to just figure out, and it takes practice, but you're trying to figure out how to release and relax that muscle so you get that crease in the hip when you actually flex the joint up. But don't progress on until you can do that. Thoughts on the Theragun or massages? Yeah, absolutely. So the Theragun itself, so if you don't know what the Theragun is, it's like a little held massage tool that vibrates on the end, or has kind of like an oscillating motion. And so you can rub it on different muscles, kind of massage it that way. Absolutely okay. Anything external, like any sort of tool like that, just keep in mind it's a tool. It is not going to take care of the problem. It will take care of one of the symptoms of the problem, which is muscle tension. And so in that case, yeah, it's great. If it's taking away some of the muscle tension and discomfort, perfect. It's not going to take away the problem, right? The movement is the problem. The reason those muscles keep getting tense and needing massage of any sort is because you're not using them correctly. So make sure that you're still addressing the movement concern at the same time. As far as massaging, like the IT band, I do a lot of massage on that TFL muscle, the hip flexor. Absolutely. If you were to come in and see me for a physical therapy appointment, we would definitely be doing hands-on massage. But just like with the Theragun, it's an external tool. So I only am doing hands-on work a little bit, and the majority of the session is spent on learning how to repattern the movement. It will keep wanting to tense up on you, again, just because you're not using it correctly. So that TFL is so overworked all the time that it gets really tense, and there's a lot of pain that goes along with that. So once you stop using that TFL so much and you stop getting that forward pressure and pinching, you won't need the massage nearly as much. Just make sure that you are using the hands-on or massage tool as a supplement to the actual movement retraining. Do you ever do a MOB with, oh yes. Oh, hey, Johnny, you're a PT, yes, or PTA, I think, right? So yeah, so if I do MOB, so prior to hip flexion. Okay, yeah. So there are a couple different ways. So joint mobilizations, again, it's a hands-on tool that a physical therapist can use, or there are some self-mobilizations you can do using bands. And basically what it is, so again, here's that hip joint, right? We talked a lot about that forward pressure, but ideally what you want is that posterior or backwards pressure to help keep the joint recentered. So sometimes what will happen is you're so used to pressing forward that the structures and the tissues on the back side of the hip joint, so like in your glute area, they get so tense that even if you try to keep this centered, there's nowhere for it to go because they're so tight on the back. So sometimes what your therapist might do, or you may have learned with some self exercises, is you mobilize it. So we use a strap or our hands to actually get that joint to push backwards. And it's just a form of stretching, really, so that it's able to glide posteriorly instead of kind of getting stuck on those tissues that might be a little bit too tight. So yeah, I'm a big fan of the mobilizations. I'll do them often at the beginning of a session so that people can feel the muscles activating more when they actually go through the exercises. Let's see, mild hip dysplasia with glute med tendinosis, some bursitis. Excited about these exercises. Good, I'm glad. Yeah, so hip dysplasia oftentimes does go along with hip impingement. So someone that has hip dysplasia doesn't have, so we've got that ball and socket joint. The socket it's not as well formed. So the ball of the femur doesn't fit into that socket as nicely. It's a little bit more flattened. So there's less stability in the joint, basically. So the goal with hip dysplasia, if you are somebody that has that, is we're still trying to strengthen and stabilize everything around that joint. So you're still going to want to do these same exercises. You just may need a little bit more specifics on some stabilization type things, as far as building up some strength in the other muscles. So these exercises will help, but then, yeah, you probably do need some additional stabilization type exercises. So feel free to send me an email if that's a little bit more specific. So I'll be glad to help you with an email that way. Okay, is there a way to do these exercises not on your knees? Yeah, so if you have trouble doing these on your knees, that kneeling rock back, that kneeling hip hinge, I would just take it right to standing. You don't have to do that kneeling exercise as a progression. You can bring it right into standing. I usually just will start in kneeling because it's a little bit simpler. But for somebody, like if I have someone that can't kneel, I'll just bring them right into standing and just kind of skip over that portion. Just make sure you can do it laying on your back really well so that when you bring it up to standing, you've got the movement down. Let's see, you mentioned popping is a sign of impingement, but I also get popping and cracking in other joints when doing things, and my knees pop. Yeah, so that's a good point. So it's not just any pop, right? It's not just like the joint popping and releasing air. Like, we crack our backs. Basically, all that is just a release of gas and air in the joint. So if you're getting pops and cracks, like in a shoulder or in your elbow when you straighten it or anything like that, or even if you're getting a popping sensation in your hip that there is zero pain or discomfort or pinching associated with it, it could be just a normal pop. However, if it is popping every single time you go into that movement, there's something going on there probably. There's maybe a little bit of a mobility limitation. You're not getting the gliding where it should be. And more importantly, what is associated with that popping? Is there a pinching sensation that happens at the same time? Is your range of motion restricted in any way? So there's other things that we're looking at as far as the pop or the pinch goes. I guess the bigger thing that we're trying to avoid, like I think that was when we were doing the one laying on your back, marching the leg up. The biggest thing we're trying to avoid with that is the feeling of pinching. So popping may have not been a good word for me to use there. So that's a good point that you bring up. But yeah, definitely if you're feeling the symptoms of the pinching or a catching sensation, that would be something that we're trying to get rid of more so than just like a normal cracker pop. Let's see. If you do mobile with movement beforehand, if they present with joint restriction. Yeah. Sounds like we've got some PTs and athletic trainers or whatnot in here. So yeah. So if you do a mobilization with movement, so those mobilizations that I was talking about, kind of gliding that joint back. Yeah. If they have any sort of a joint restriction. So if you're noticing that there's a limitation in range of motion or they can't get that posterior glide, then yeah, that mobilization is something that I would use. I don't necessarily use it on every single patient. It completely depends on how they're presenting to me. And it may not be something that I need to do with my hands. I may just show them how to do the mob with a super band or something on their own. When I do turnout, my piriformis muscles hurt. Can you show me something for that? Yeah, so stay tuned because we did not get into the turnout stuff. We didn't get into the dance specific things. Stay tuned. I am going to be doing a dance specific progression of all this hip impingement stuff. This one was just more for general public. But stay tuned and I'll be sending some information out about that as well. Thank you for sharing. Oh, you're welcome. My pleasure. I thought this, hopefully, this seemed to be the topic that was most needed. When I did an Instagram live a week or two ago, this was the thing that everybody kept asking questions on. So it's definitely something I think that's really needed. It's very prevalent in the general population as well as the dance population. This issue probably makes up about 90% of my clientele. So I treat this often. So please, if you have specific questions, don't hesitate to reach out. I'm more than happy to answer any more questions that you guys have. Head over, follow me on Instagram. It's @OnPointe and I'll be posting some more information there about upcoming workshops, some other exercises that you can use for hip impingement. So yeah, hopefully everybody found this to be helpful. I love doing it for you guys. And don't forget to, in that chat box here, if you guys have any suggestions on what you would like to see in the future, please let me know. You can send me an email. You can write it in the chat box, but I'm definitely looking at putting together some more live workshops for you guys. So let me know what you want to see and we will get them out there soon. All right, guys. Hope everyone has a good rest of your day.